We begin with this question: what threats are quiet career killers? In this episode, we're going to identify the primary threats to dental clinicians. We will discuss work-related musculoskeletal disorders, or WMSDs, and additional primary threats. You will gain an awareness of the risks associated with WMSDs and the signs and symptoms to be aware of for you and your team. The first of these threats are work-related musculoskeletal disorders, or WMSDs. Posturally, dentistry creates multiple challenges and problems for the physical health and well-being of the clinician. Let's take a look at some of the statistics. 75% of all dental care providers complain of one or more carpal tunnel symptoms. An alarming 59% of dentists report musculoskeletal pain, and 50% complain of back and shoulder pain. Work-related musculoskeletal disorders, or WMSDs, are the reasons for early retirement of 29.5% of dentists. We believe for hygienists it is that and probably more. Beyond the threats of WMSDs, 87% experience problems with eye strain. We will examine this in depth later. These issues are compounded for a number of dentists whose retirement plans have been adversely affected by the economic challenges of the last decade. Too many dentists are now faced with the need to extend their careers at a time their bodies are dealing with the wear and tear of 30+ years. This next infographic indicates the order of incidence of WMSDs in various areas of the body. It also shows the variance between males in blue and females in purple. Burke reported musculoskeletal disorders were the #1 cause of early retirement in dentists at almost 30%. This infographic illustrates additional causes of early retirement. With the significance of the threats demonstrated by the numbers, we examine the risks that lead to the problem, and we identify the signs and symptoms of these threats. Force plus repetition plus position and posture plus no rest equals musculoskeletal injury. In dentistry, force and repetition are usually fine motor tasks, and the position may be an awkward, prolonged, static posture. As mentioned, one of the major risk factors is prolonged static postures, staying in an unhealthy position for an extended period of time, inadequate rest, or infrequent breaks. Additionally, repetitive tasks and overreaching create WMSD issues. Looking at the risk factors for various team members, dentists often put themselves in awkward static positions to improve visualization of the mouth. Assistants also assume awkward static positions and lack arm support. Hygienists often find themselves in awkward and static positions, as well as experiencing repetitive finger and wrist strain. These risk factors are not limited to the clinical team. Members of the administrative team often have problems using the computer, telephone, and the overall stress of their role in the practice. Signs of WMSDs include decreased range of motion, deformity, decreased grip strength, and loss of muscle function. Musculoskeletal symptoms of dental clinicians are many and are task and position related. Neck pain caused by awkward positioning to see into the patient's mouth. Back pain caused by poor sitting posture, static positions, leaning and twisting for access to the oral cavity. Shoulder pain caused by maintaining arms in an unsupported position out away from the body. Elbow, wrist, and hand pain aggravated by repetitive forceful movements, static grip pinch instruments, and handpieces. Additional symptoms to be aware of are headaches initiated by prolonged periods of poor neck posture or static positions and stress. Numbness and tingling in the arms and hands triggered by nerve problems in the neck and upper back and vibration from instruments. Numbness and tingling in the legs caused by nerve problems in the lower back due to improper sitting posture and support. After this discussion, do you or your teammates suffer from WMSDs? If so, what signs and symptoms are you experiencing? If you are affected or concerned about these risks, we encourage you to follow subsequent episodes and enter your questions or comments below or on our contact page at CaringQuest.com. In the next episode, we take a close look at how these threats occur. As always, we invite you to send your questions to michael.couch@caringquest.com and like us on Facebook at facebook.com/caringquest.